Hey guys, sorry about the early cutoff on the last video. I wasn't watching my time as I was chit-chatting with you guys, so it just cut off. I only have about 15 minutes per recording with the software that I'm using. So continuing with Alzheimer's disease, some of you may be affected by this, whether or not your grandparents, great-grandparents, or even maybe some of your parents can show early signs of Alzheimer's disease. A lot of you may work with the elderly as well, and even though you work with them and they're not your relatives, it's kind of hard not to have a soft spot for this population when we're working with them. But statistics show us Alzheimer's is the most common form of dementia. It leads to about 100,000 deaths each year because it's a deterioration of the neurons in the brain that causes Alzheimer's disease. 19% of people ages 74 to 84 have Alzheimer's disease, and there's different levels of it as well. Once you get diagnosed, you have it, unfortunately, for the rest of your life. And for some people, it's more of a gradual onset. You can have early onset, meaning you're diagnosed with early stages of Alzheimer's before the typical age. And then you can have late onset, where in the 80s, 90s. But some people, once they're diagnosed, it's more of a gradual process. So over the course of 10, 20 years, if you're lucky, and it slowly progresses. Other people, it's more fast progression. So it really depends on the person. Over half of people age 85 are affected by Alzheimer's disease. Again, you can be 90 and just get a diagnosis with it as well. There are a lot of different symptoms of Alzheimer's disease. So if you have a family member that you think is suffering, they of course have to go to the doctors and have this questionnaire done with them. They interview family members, and then the doctor may do some brain scans to see what's the best possible course of action for that particular person after they get diagnosed. But unusual forgetting, besides, I can never just find my keys. I can't find my keys some days now at my age. So it has to be more than just your typical forgetfulness. Trouble recalling particular words during conversation, and you see this continuously. It's more than just the occasional tongue-tied, that type of thing. Recent memory goes first, then older memories tend to follow. Eventually, there's a lot of confusion with the person. The ability to speak intelligently and carry on conversations starts to dwindle. Being able to recognize consistently family and friends also will start to decline. Towards the end, the progression of the disease, there's a lot of muscle control issues, especially with going to the restroom, feeding themselves. Eventually, in the latter stages of this disease, they will be bed confined, so they will not be able to take care of themselves, get up and walk around, things like that. Victims, of course, that are in the early stages of Alzheimer's disease can experience a lot of anxiety, fear, depression, because we know there's no cure. We know where it originates from and what part of the brain it affects, but with the help of medication, for some, it can slowly shorten the progression of the disease, but it's not a cure-all. So if you are given that diagnosis, knowing that can cause a lot of depression and sadness because you know the outcome. So there's a lot of brain changes. They know that there's a protein, the beta-amyloid precursor protein is where they find Alzheimer's in the brain. Again, memory starts to decrease, so you should, of course, know that the hippocampus is the part of the brain where memories are mostly formed. Frontal lobe, decision-making, temporal lobe for hearing, of course, Broca's for speaking, motor cortex, all of that is all affected by it. So triggers, there's really hasn't been any confirmed triggers for Alzheimer's. We do know it's genetically, so if you have a parent or a sibling who suffers from Alzheimer's, you're at a greater risk for it as well. Poor diet, and high blood pressure can also put one at increased risk because of how foods interact with the brain, and not being active as well can influence that. Viruses, certain immune system deficiencies, hormones, imbalances, all of those things can trigger Alzheimer's as well. And of course, those who already have a low cognitive ability tend to suffer from the disease as well. So here's some brain scans. Up top here are normal brain scans, nice and blue, and kind of have an equal amount of brain energy in them. Down below, oranges are these plaques that kind of build up that don't allow the neurons to grow and to function accordingly. And that's where we start to see the degeneration, the neurons dying out, and of course the brain shrinking within itself. So treatments, of course, we know there's no cure. Drugs, we know neurotransmitter acetylcholine is where Alzheimer's originates from. But, we can give medications to try to slow the process, but there's no cure. Anti-inflammatory drugs can help with it. Chemicals high in C and vitamin E can also help. Eventually, prognosis, most patients end up in nursing homes. Of course, caregivers suffer greatly as well with Alzheimer's disease because they see the progression that this horrible disease takes on their family members. And every time they see them, and as the disease progresses, the disease is they see their family members start to slowly, cognitively, physically deteriorate and die, and there's really nothing they can do. Of course, some family members try to care for their mothers, grandmothers, sisters as much as they can without putting them into a nursing home, but unless you have the monetary supplies and resources to care for them in the home, as the disease progresses, they do end up having to go to a nursing home until they finally pass away. So it affects negatively just not the person who has it, but the family members, the caretakers, friends, if they're still close to them, all of them as well. So there's a lot of resources out there that can help, and I'm just spending more time on this than I usually would because I know it can affect many of us in different ways. So label objects for them as they start their progression with the disease. Give them calendars. Don't give them a lot of choices. Keep them on a schedule. Of course, don't let them drive. Do still try to provide them exercise because it helps with the brain and, of course, their muscles as well. Use support services. There's a thing called respite services where nurses and caregivers can come in and sit with your family member for an hour or two while you can go lunch or go, do some social supports of yourself. Support groups. So there are a lot of resources available if you have to come and be the primary caretaker of your family member. So now we're going to switch over to wellness in late adulthood. Of course, keeping healthy really depends on three different concepts: your genes, your environmental conditions, economic, and the fourth, four is your psychological well-being as well. So all of those combine. Genes, you can only do so much with your genes. Environment, trying to live in a supportive environment, eat healthy foods, exercise. We know as we get older, especially if we don't work, our monetary resources can change. So if we don't have insurance or access to health care because we don't drive or nobody can take us, that can impact how we get medical care as well. And then psychological factors, depression, anxiety, all of that can come into play. So you have to make sure you still continue to take care of yourself in our older population and our older years as well, so that we can have lifelong sustaining good health as much as we possibly can. So sexual activity in old age as well. use it or you lose it. It's much harder to regain sexual activity in older age if we haven't been participating in it for a long time as well. So I know it's not anything any of us want to think about, but it's still an important part of feeling human and having life satisfaction to have sexual activity into our 80s and 90s, okay? So don't think it's anything wrong with that. We know in nursing homes that besides the younger population, 18 to 24, we still have a lot of issues, and we've talked about this before, with sexual activity and sexual transmitted infections in the elderly population because, you know, they're past menopause, they don't have to worry about getting pregnant, they don't assume that, you know, their partners are going to have any sexually transmitted infections anyway, things like that. So we still have to worry and educate this elderly population about the dangers of unprotected sex. So, all right, two major theories of aging that we're going to go over real quick. Genetic programming suggests your body's DNA code contains a built-in time limit that after a certain age, everything just goes downhill. So our genes play into that. We can only do so much with our genes. And then the wear and tear theory suggests our body simply wears out. Free radicals kind of resources continue, but over time, our body just eventually wears out, and there's nothing we can do about that. Oh, I don't know what I did. I'm so sorry. There we go, right there. So reconciling the theories of aging, there's two different types. Life expectancy depends on genes and your lifestyle. We know life expectancy continues to increase. The more active you are and the healthier you are, the more you'll be able to live a healthy life. So everybody really depends and is individualized in regards to how long they will live. We can try to postpone aging, but of course that really depends on what monetary resources you have and what physical and emotional health you have as well. So restricting calories can help. Worn out organs, we can replace some of those, not all. Drug therapy, those type of things, but not everybody has the resources for these. So it really just depends, but most scientists and doctors say eating healthy and being physically active are two of the greatest ways to try to curb the aging process. And of course, we have to look at cultural differences to aging as well. So average white child in the United States lives about 78 years. Average African American child, 72 and a half. Japanese children likely to live 83 years, and so on. So males, they typically live less than females because females typically will go and get medical care for things where guys usually won't. Of course, how cultures see nutrition, physical fitness, that plays into things as well. So if you have any questions, let me know, and our next video will cover Module 2, which will be on intelligence.